The operation that will make you look younger and visually lose 5 to 7 years. Now attempt to guess which surgical manipulation could potentially result in such a magnificent outcome that is visible in the photograph displayed on the screen. An open gaze, a rested look, no sagging eyelids and more. And if any of you thought today's topic would be about blepharoplasty, I will surprise you because there is no blepharoplasty here and not a single eyelid was harmed in these photos. And all that you have just witnessed is the outcome of an endoscopic lift of the upper third of the face, utilizing a contemporary technological approach, the outcomes of which are largely comparable to blepharoplasty. By the way, surgeons occasionally combine these two techniques, so if you believe that only blepharoplasty can resolve the issue, I strongly encourage you to initially consult a competent specialist in endoscopic lifting. We select very cautiously to avoid individuals who suggest blepharoplasty solely because they lack expertise in endoscopic techniques. The endoscopic method of lifting the upper third of the face raises the eyebrow line and smooths the tissues of the upper eyelids, making the look fresher, more open, and also allows achieving a maximally natural result. The forehead area is smoothed and the orbital zone recedes, even deep wrinkles. By the way, this procedure is not only done to correct age-related changes, but also to enhance the proportions of a youthful face. Endoscopic lifting of the upper third of the face is the sole effective and stable method to achieve that desired absolute trend of recent years coveted by many individuals. Fox eye effect. In this case, the effect is usually achieved through lifting of the eyebrows, forehead, and temple area. Aisa Anokina, Victoria Boni, Kim Kardashian, Bella Hadid, and many other successful and famous individuals have achieved their luxurious predatory eye shape precisely thanks to this method. It is important to understand that many of the beauties listed above have achieved their perfect faces not only through the fox eye technique. Let's take a look at Bella Hadid. For example, here, first and foremost, of course, there is the obvious upper facial lift. It's the one that perfectly lifted her eyebrows and formed a mesmerizing almond-shaped gaze. Second, at a fairly young age, Bella underwent serial plastic surgery. And third, looking at several other photos, one might assume that the removal of Bisha's tonsils was also involved. However, I won't claim it, and sincerely hope that it was not necessary. This operation has lost its relevance in the modern world, as there are plenty of other ways to achieve the same result. I've already discussed this and other operations that are becoming outdated on my channel. Take a look if you haven't seen it yet. And be sure to write your versions on Bella's operation in the comments. I will be interested to read them. How to know if endoscopic lifting of upper third of face is right for you? Procedure recommended if you have non-drooping eyebrows and frowning facial expression. Deep wrinkles on the forehead and between the eyebrows, excess skin in the area of the glabella, skin sagging, and muscle tone reduction. How does this operation proceed? Allow me to clarify. Endoscopic lifting of the upper third of the face is a surgical procedure that involves the use of endoscopic equipment and specialized instruments. Through miniature incisions approximately 5 mm in size, which are located in the hairline area and become completely unnoticeable after healing. Using these accesses, a small device called a trocar is inserted for tissue dissection. After that, the surgeon moves the tissue of the forehead and eyebrow lines to a higher position and fixes them there using special stitches or fixators. By the way, what and how the tissue is attached is crucial and affects not just the final result, but also the comfort during rehabilitation. And you must know about attachment types when selecting endoscopic lifting of upper third of face, and also for middle third and facelift procedures. Soon, a video on this topic will appear on the channel. In it, for you, I will reveal professional secrets. Subscribe to my channel. When discussing lifting in the upper third, it is important not to focus on the superficial layers of the face, but rather on the almost deepest layer, and to lift the entire complex of tissue. This is exactly how a natural and long-lasting result is achieved. But here lies the complexity and danger of the operation if done by an inexperienced specialist. In the deep layers, nerve endings are intertwined with muscles and other tissues, and when performing this technique, one must skillfully separate the layer needed for lifting to avoid touching anything unnecessary under any circumstances. Errors can cause facial nerve damage, leading to loss of facial expressions and sagging of the face. Therefore, I urge you once again to carefully and meticulously choose a surgeon, because only a few are capable of truly high-quality execution of this technology. I started my journey with craniofacial surgery and later specialized in plastic reconstructive surgery in the head and neck area. With 17 years of practice, I've gained unique skills and performed 2,000 successful surgeries. This allows me to be confident in the result of each similar procedure. Endoscopic lifting of the upper third of the face typically doesn't last long, from 1 to 2 hours, and it's not always done under general anesthesia. For instance, in the US, surgeons often perform operations under local anesthesia. In these cases, patients can leave the clinic on the same day. Sedation is also used. It is a local anesthetic, and the patient in this case stays in a light sleep. In this situation, the patient can leave the clinic in only 6 hours. And only if general anesthesia is used, the patient still requires medical supervision for 1 day. The cost of endoscopic lifting in Dubai averages around 20,000 at the top. This is around 400,000 rubles. Often, right after surgery, the doctor applies a special compression bandage, which the patient should wear for a week. But my opinion differs significantly from some colleagues, and during the rehabilitation period, I adhere to my individual scheme. I am convinced that wearing compression bandages and braces in this case does not provide any lifting effect, but rather hinders lymphatic drainage and increases swelling. And thus this extends the rehab period. That's why I don't torment my patients. And only in some cases I can apply a circular bandage as a bandage on the forehead for 1 night. And sometimes not even for over an hour. And that's it. Everything is taken out, and the individual is sent home with no bandages. But it is important to understand that the recovery period may be accompanied by painful sensations in the first day after the operation, which can be relieved by taking regular painkillers. And we cannot escape from swelling and bruising either. But it is normal, and they usually disappear within 2 to 3 weeks. Sometimes numbness or tightness may be felt, but both usually subside within a month. We will see the first before and after results by the end of the first month of recovery. However, a partially formed outcome can be assessed fully in, let's say, a period of 6 months. In the first month, no hot bath, sauna, bathhouse, solarium, limit physical activity, essential for recovery. Contraindications to endoscopic lifting of the upper third of the face are standard, the same as for all similar surgical interventions. These are diseases, exacerbations, oncological and autoimmune diseases, heart diseases, vascular diseases, blood clotting disorders, pregnancy, and lactation. In conclusion, I can say that endoscopic lifting of the upper third of the face is an excellent modern solution in combating age-related changes. The technique allows for minimal trauma to achieve maximum results, which can be maintained on your face for many years with proper care. Take care of yourself and always choose the safest path to the desired beauty. Subscribe and ask questions in the comments. I will be happy to answer.